Unlike some folks who have to live in the West End, I chose to live in the West End. The reason that I got involved with CAB is because I love my community.
As someone who majored in public health, I see the importance of vaccines. I know for a lot of people, they think public health is just healthcare, but it's actually involving the community.
I think the main thing is education. There's a lot of misconceptions, there's a lot of conspiracy theories. Also, you have a lot of people in this community who don't have a relationship with their healthcare professional.
I'm hoping that we can let people know that, your health comes first and that there are people there who care about you and want to fight for your benefit.
Go to the website, we got tons of information for you.
Vaccines, going to the doctor, these things are for their benefit, and I just want to advocate for them to let them know, hey, I'm always on your side. You have someone that's willing to speak out for you if you feel like you don't have anyone in your corner.
Hello to those of you that are watching Conversations with CAB. Thank you for your continuous support and tuning in. Today, we have a guest and we just want to get to know her a little bit. Can you introduce yourself?
Hello, my name is Reeshaw Williams. I am a pediatric dental assistant. I have been doing pediatric dental assistant for 5 years now, and actually enjoy it.
So what made you want to tap into that lane career-wise?
I was working in the mental health field, like as a counselor, going into homes. And at the time in my life, I needed a change. So I still wanted to be working with children, but just in a shorter span of time. So it allowed me to still work with children and,
So it was the flexibility which allowed you to change your career? You wanted something more flexible? Or was it the job in general that kind of helped you gravitate towards pediatrics?
It was the job in general, because I still wanted to work with kids, but when you're in the situation with like counseling and mental health, you kind of got to make sure yourself is taken care of. So I needed to take a break actually and take care of myself first. And so when you're working in the pediatric field, it's not as intense. You're not getting so much information put on you from others and having to figure out help other people with their lives when you're trying to figure out your own life. So that's part of the transition.
And I like that you mentioned your mental health and taking a break, because we just got done talking about how important it is to, pay attention to your mental health.
Yes, definitely is. Listen to yourself. Yes.
So as you know, COVID took a huge turn on the U.S. when it hit the U.S. And I know you work in a pediatric office, so can you kind of talk about how COVID impacted people receiving health?
So normally in any dental practice, you want to see your patients at least twice a year. Those will give you their routine checkups. They can make sure there's no cavities. Once a year, you'll take x-rays. So when COVID occurred, you had people who couldn't get those regular checkups that they needed. So then if there were cavities or anything that was causing those patients pain, they wasn't able to come find out it's an issue and then do the follow-up appointments so that they can get treated for those. So what you find is that because of that time and that break, people continually put it off and they're like, oh, during COVID, I couldn't make it because of this. Then life got it away and it's still because of COVID. Now, things that could have maybe been taken care of a little sooner have been pushed back even more because life is still life and as we go. So I think that's been the most thing that has affected a lot of dental offices and people receiving treatments.
So during COVID or even post-COVID, were the dental offices fully closed or were there just stipulations that you guys had to work under?
So I think a lot of offices went to what we call like an emergency team. So it's basically like if you're at home and your face is swollen or your kid is crying every night, you could call that office and they would have an emergency team. And if it was like, okay, let's give an antibiotic for an infection or this tooth needs to come out immediately, they could take that out. Or they could refer you to whomever you needed to go see if you need to go see a different type of dentist. But for the most part, I think most places worked on an emergency basis, like need to be treated. They did amp up the PPE because normally we might just have on glasses and a mask during COVID, or when we returned back, as a lot of teams started returning back, it was like masks, eyewear, full PPE gowns. So you did see that in like the first about 6 months to a year after coming back, you've seen that we used a lot more PPE in the dental offices. coming.
So in order for children to, get reestablished and get their health appointments back, did they need to be vaccinated, or could they just come and reschedule once COVID was completely over and the offices reopened?
I think that was on the office basis. What they expected I think one of the main things that the offices did upon people returning back was checking temperatures. We all were getting our temperatures checked to see if we had fevers. Are you coughing when you come in? So it's kind of like a quick overview. Like if you went into a regular office and they're like, okay, let's take your vitals. It was almost like taking your vitals to see if you were sick before we let you come to the back to be treated. I can't speak for what every office did. I don't think it was mandatory in the office that I worked in, but we definitely checked temperatures and if you're coughing, are you sick? We ask that, like, if you've been sick, if anyone in your home's been sick, please just reschedule your appointment. Yes.
And so those things that she's talking about, it just helped to prevent people from further getting sick as COVID came to an end and the dentistry and the healthcare started to open back up.
Yes.
So I also wanted to touch base on how important is it to, especially for pediatric children, to get oral health or have oral appointments?
It is very important. I know a lot of us think these are baby teeth. They will come out, but sometimes the things that go on with those baby teeth can affect the adult teeth. So losing teeth too early can affect how the adult teeth know how to come in, because some teeth will come out and what happens is those adult teeth follow those teeth. And if they come out when the kid is 2 and it doesn't know where to go. It's just like, hey, I could come in here, I could shift, I could go wherever. So that's one of the reasons why it's so important for kids to see a pediatric dentist.
And so do you have any personal story or maybe like a heartfelt story of a child that you've encountered who had like a severe oral issue that could have been prevented but wasn't prevented because of COVID?
So there are plenty of stories. And it just happens that just like all of us, we all have personalities, right? So some kids will come and they just got a great personality, so it sticks with you more. But I will say in that when you're seeing stories, they're all kind of hurt because when they're 2 and 3 and 4, you have a stranger laying you back, and then they're all in your mouth and doing things that you like, what is going on? You can hear sounds that you're not familiar with, so you got tears and you're trying to guide them through, like, it's okay, we're here to help you. And then the parents are also upset because here goes their baby who doesn't know what's going on, and you're trying to help their kid. So they all it's all just like painful. It's like you leave work some days like, oh goodness. But I think that some of the things that we do are preventable. However, we're not aware. And I think that the awareness should probably start when moms get pregnant, or I won't leave out dads. So mom's pregnant, but dad should know too, because some dads may need to step up more. Maybe mom's not able, maybe she doesn't know. So I think that knowledge should start as soon as a woman is pregnant.
We thank you so much for educating us on oral health and just, your opinion on how healthcare for children, especially orally, was affected by COVID. We thank you so much for educating us on how important it is for pediatrics to receive oral health, and also explaining how COVID-19 has had an effect on pediatric health. For any more questions or for further resources, please go to www.westlouisvillecab.com. Until next time, thank you.